Today, we will delve into the topic of cardiac arrhythmias, exploring the complexities of heart rhythms and their implications on health. Let's start with a basic overview of heart anatomy. Understanding the structure of the heart is crucial for comprehending how arrhythmias occur. Normal sinus rhythm refers to the heart's regular, steady rhythm when it functions correctly. It originates in the heart's natural pacemaker, the sinoatrial node, and ensures efficient blood flow throughout the body. For a rhythm to be classified as normal sinus rhythm, the heart rate should be between 60 to 100 beats per minute, with impulses originating from the SA node and passing through the normal conduction pathway at normal speed. The normal conduction pathway starts from the SA node, spreading to the atria, then to the AV node, and finally through the bundle of His and Purkinje fibers to the ventricles, ensuring coordinated heartbeats. Cardiac arrhythmias occur when the electrical impulses controlling the heart rhythm do not function correctly. This can lead to the heart beating too quickly, too slowly, or irregularly, posing serious health risks. Arrhythmias are classified into bradycardia and tachycardia based on heart rate. Bradycardia involves a slower heart rate, while tachycardia involves a faster heart rate, each with varying degrees of severity. Here, we see different ECG patterns associated with various types of arrhythmias, including sinus arrhythmia, tachycardia, bradycardia, and fibrillation, each with distinct characteristics. Arrhythmias can also be classified based on their location of origin, such as sinus, atrial, junctional, and ventricular arrhythmias, each affecting different parts of the heart. This diagram illustrates the pathway of electrical impulses through the heart, highlighting the normal flow from the sinus node to the ventricles, which is crucial for maintaining a regular heartbeat. Common symptoms of arrhythmias include heart palpitations, chest pain, shortness of breath, lightheadedness, sweating, fatigue, anxiety, and confusion, which can significantly impact daily life. A Holter monitor is a portable device used to continuously monitor heart rhythms over 24 to 48 hours, providing valuable data for diagnosing arrhythmias. Diagnostic tests for arrhythmias include ECG, Holter monitoring, echocardiograms, and stress tests, each offering unique insights into heart function and rhythm abnormalities.